Hello everyone, welcome to my postpartum essentials video. I have cleavage here and my baby 5-month-old Raven Isabella. She's a little cranky, but we're going to try to record this video anyway. She is 5 months, so I'm 5 months postpartum, and I think I'm out of that like rough and bumpy postpartum period that I can share my postpartum essentials with you. I'm just going to start off, since this is a little oily on the outside. This is some olive oil that I use mainly as like a nipple cream. When I was first postpartum, I no longer use a nipple anything for breastfeeding. I am still breastfeeding, but I don't need anything, and I'll just use a little bit of olive oil or coconut oil after each feed during that beginning period. Next, this was very essential. It is a Perry bottle. You get this at the hospital. You can probably get it at the drugstore too. She's trying to look at me. And I use this after every toilet up until I was probably 12 weeks postpartum. It gives you a nice, fresh, clean feeling, and you don't have to be wiping and wiping and wiping. You just spray with this. It refreshes you. It cleans you, and then you just pat dry. It gets rid of all of that stuff. She wants to look at me. Look at her hair. It's all loose in the back. I didn't comb that part. I just combed on the side. She is losing a little hair, as am I. Postpartum shredding in full effect on my edges, but it'll be okay. That's not what this video is about. Next, most importantly, one important thing is these. These are the hospital grade maxi pads that you get from the hospital. I personally love them. They're very absorbent. You bleed from a large area when you're postpartum. Your stitches could be bleeding. I had stitches. Everybody doesn't have stitches, but you're wide open, so you're bleeding from a much larger area than you do during your normal cycle, and you need more because you're bleeding a lot, and you're bleeding in gushes. It's not consistent. When you're laying down and you get up, you're gonna bleed. You sneeze, you bleed. You know it's gonna gush out, so you need something highly protective. And to go along with these, which I took as many as I could from the hospital. I also took as many of these from the hospital. These are the mesh underwear that everyone talks about, the infamous mesh underwear. I still have 2 pair. These are clean, unworn. And they stretch. Boy, can they stretch. But you know, everybody doesn't need that much space, but if you do, they are accommodating and very comfortable. So they're just open here, and it's just sewn together there. It holds that big old pad in place. Everything is just nice and there, and not, you know, hurting you, and they can stretch. So I love those personally. If you want to just wear big underwear, you can. When I moved on to that phase, I would wear these. These are Stay Free maxi pads. These are the maxi pads overnight, and they have a big wide thing, space in the back to catch stuff. And they're long, they have wings. And once I moved out of maxi, I used these. These are the same overnight, with the same shape, very long. They have a leak guard. It's a big wide area. You can put it to the front or the back, wherever you need it for your bleed. But these are ultra thin. So once I was in the phase where I wasn't bleeding as much, closer to like 4 or 5 weeks, I started to use these. Dermaplast, I got this from the hospital, and I would use it a lot because I had the stitches. They bothered me. So I would spray this on there, but after a while it started to burn a little bit, the menthol, and the pain from the burning started to outweigh the pain that I was feeling, so I stopped using it. But in the beginning, I loved this stuff. And once I started to have vaginal atrophy from losing estrogen from breastfeeding so long, I used it again before I could get some lubricant. This is a lot of information, so if you don't want TMI, this isn't for you. Before I could get lubricant to kind of help solve that problem, I would use this on the little scrapes and cuts and wounds that you get in your vagina when the skin is very thin. Going along with that, these are hemorrhoid pads. They are soaked in witch hazel. They are for hemorrhoids, which I did end up getting like a tiny case of hemorrhoids around 4 weeks when I started eating a little bit more recklessly, and the stools weren't as soft. I needed these, but I also use these to comfort my stitches and to comfort my vagina during different time periods. And I also use these as like face wipes, as like an astringent. Once I had beautiful skin during my pregnancy. Well, it might not have been beautiful to some, but it was the best skin that I had had my whole life. And once I gave birth, my skin went back to breaking out all the hormones and stuff, so I would use these. And I think I had some, I can't find it now, but I had some hydrocortisone cream that they also gave me for my stitches in that bottom area that I will also use on my face because it got really crazy. I didn't use the hydrocortisone as much down there because I didn't want to put a cream down there because it was already gushing and stuff. So I didn't use it as much. That I also use these a lot. This is a reusable overnight strength breast pad or nursing pad. When you leak, I used to leak like an ounce from the side that I was nursed from. Like if I was nursing on this breast would leak like an ounce of milk during a feed, and I would have to change my nursing pads pretty often. But you need the overnight. The daytime strength from Bamboo Beast does not have a leak proof backing, but these do, and they work. They're like extra absorbent, and I love them. I still use them till today. Even though I don't leak as much, I need a nursing pad, at least for like one in the daytime and then one at nighttime. But you want to keep yourself dry, especially if you're having cracking or bleeding or anything like that. Stay dry as possible, and that will keep your chances of thrush down and everything else. So I love these. I needed these from when I first started. Even though I use disposables too, they're pretty absorbent, but these work very well, and I don't have to keep buying disposable nursing pads because they get expensive. What you want to buy, the Stay Free, not always has a weave on top that can catch your skin and that and snag your stitches and stuff, so it's not really that good for postpartum. But the Stay Free has like a cotton top, and it's very comfortable. And olive oil. That's really all I bought. The rest I did get from the hospital. Depending on your hospital, I got the mesh underwear, and I probably came home with like lots of them. Whenever the nurse would bring more, or the tech would bring more, I would put the majority of them in my bag and like hide them, so that the next time a tech came in, they would give me more. Same thing with the pads. I came home with loads of these pads. I love these pads. I love the mesh underwear. These, the Peri bottle, the hemorrhoid pads, and the dermaplast were all given to me by the hospital, as well as hydrocortisone cream. So that is it. So basically the hospital gives you most of what you need. All you need to buy is more pads if you want to use them at a certain point. The flow got to be so low, and my skin got so irritated from wearing pads for like 6 weeks straight. I just stopped wearing pads. It's that gross, and it kind of puts you in the mind of what a baby's bottom is going through when you put them in diapers 24/7. That's kind of what I got from it. But that is all. I hope you enjoyed my postpartum essentials video. I hope you enjoyed seeing little Raven. Say bye. Say bye. She won't look at the camera because she's looking at other stuff. Say bye, little baby. Bye, little baby.